Good morning, everyone. It's Kerry Jeffrey here from Emotional Autoimmunity. And for those of you who don't know me, I am a clinical hypnotherapist, a counsellor, and a life coach. And I work with people all around the world and in Australia using Skype to help them overcome the emotional side of life with chronic illness, as well as helping people who have either toxic parents or very toxic family members or relationships in their life. So I've chosen this topic today because I know on my page, this page, Emotional Autoimmunity, and in my free Facebook support group, which is called Emotional Autoimmunity Recovery Support, is that a lot of the times it's the people closest to us who don't really feel supportive or who really don't seem to get what we're going through with chronic illness, especially friends and family as well. It makes it really, really difficult to get them to understand the enormity of what's happening to you and what continues to happen to you on a day-to-day basis. So I thought the best way to deal with this would be just to do a live about it. Now, the way that I work is I get easily distracted, so won't be taking any questions during the broadcast, but I will allow time at the end. So if you've got any questions, write them down. If you're sitting there at home now and your partner's in the other room, go and grab them and bring them in, because this is really going to help them as well. It's going to help you as the person with chronic illness know how to talk about what you're going through in a way that is guaranteed to get you the best possible result. And if you're the support person or the partner or a friend or a family member of somebody with chronic illness, then this is going to help you know what to say when they're talking to you about it, and how to respond and how to give support without feeling like you're being completely overwhelmed, without feeling guilty, without feeling any of those sort of things at all. So I've got some notes here. Let me just grab them. Right. So the first thing for everybody to understand is that when chronic illness comes along, it is a great big fat hairy deal. Like, it really is. And when I remember back when I got chronic illness, because I just thought I had a really bad flu and something was really wrong with me, to be honest, I thought I had cancer. That was how quickly I got sick and how sick I rapidly became. The whole world of chronic illness was completely unknown to me. I knew people that had, rheumatoid arthritis. I know a member of my family had Graves' disease. So I sort of knew about it, was on the fringes, but I didn't understand the enormity of the impact, all of the grief that goes along with it, the way that your life changes, until it happened to me. And honestly, that was the hardest part to come to terms with, because my first doctor basically just told me at my sickest that I would have to take my little tablet and I would need to get used to this new normal. And my new normal then was physically and cognitively disabled. I could not work. I could barely function. I could barely get from the bed to the couch. Showering exhausted me. Talking exhausted me. I wasn't able to think clearly or communicate clearly. At some stages, I could barely hold my body upright when I was sitting on the couch. I would just fall over sideways because I didn't have enough energy in my cells to hold my body up with Hashimoto's. So this was like being thrown into this brand new country with no guide, no direction, no compass, and just being told, good luck, do the best that you can. And that was terrifying. I felt like I had lost myself. It felt like my whole life had been completely wiped off the table by some big cosmic hand that came sweeping down and just knocked away all of my plans, all of my dreams, all of my employment, all of my energy, all of my focus, my ability to think. Everything was gone. And this is the biggest thing about chronic illness. It is trying to convey to the people that we love or the people that we work with that this thing has come along and it has changed so many things. Now, it's important to understand that everyone is different. So I have Hashimoto's, celiac disease, and antiphospholipid syndrome, which is a blood clotting disorder. So other people may have exactly the same diseases as I do, but the way that they will be affected is completely different. And there's a whole lot of factors that go into this that are very poorly understood. And many of them are environmental. Some of them are the own person's ability to cope and look after themselves. Some are the amount of support that is around that people. Some of them are the choices or the options that they have. So everybody is going to be affected differently. So just because you know one person with chronic thyroid disease who seems to be going along really well and they're still working and they're still running and they're still doing all the things they did before, you can't look at that person and judge everyone else and say, well, if they can do it, why can't you? It's not that simple. When you get chronic illness, depending on the severity that you have it, depending on how long it's been attacking your body to the point where it's affected your organs, that your body can be compromised, will depend on how it impacts you on a day-to-day basis. And what people don't understand with autoimmune disease, because autoimmune disease is a chronic, so for life, inflammatory, which it's inflaming, creating heat and swelling, and parts of the body are being attacked, and it's ongoing. So once you have chronic illness, you can't cure it. It doesn't go away. It's something that you need to learn in your own way how to manage and how to adapt to and how to adjust to on a daily basis. And that's the way that it is. So to anybody listening, if you're the person with chronic illness, the first thing to really understand is that this is a big deal. All right? It has changed things in your life, and there are things that are going to need to be different. Now, it doesn't mean they're going to be that way forever. I'm certainly in a much better position than I was nearly 4 years ago when I was so profoundly disabled. And that's a result of all of the diet and lifestyle interventions that have taken place and all the work that I put in to manage my energy, and even then I still have my bad days. So what you're seeing sitting here is not representing what's actually going on inside me. So it is a big life-changing thing. And when you try to talk to the people in your life, they don't really get it. And there's two reasons that they don't get it. So the first one is the method of delivery. So how are you talking to the person about the chronic illness? Because there is a much better way to talk to people about chronic illness that I'm going to share with you that is going to help you get people to understand to the best of their ability. The second thing that gets in the way of people understanding chronic illness is that I think other people may disagree, but for me, I would never have understood it unless it had happened to me. People only get it when they get it, and then they understand the enormity of it, then they understand how much it changes things, then they understand how little actual medical help and intervention there is, then they understand how much of that is up to us to adapt to all of the changes and sometimes the disabilities that chronic illness brings into your life. So it's one of those things that unless you've experienced it, it's really difficult to wrap your mind around. And I know I was one of those people before it happened to me. So the other reason that blocks the communication and makes it difficult for your friends and family and partners to understand is that when you tell most people that you've got a problem, and you've probably found this with your friends and your partner and your family and your co-workers, that any time you've got an emotional problem, like you're really upset about something, you're feeling really overwhelmed, you're feeling really pissed about someone or something that's going on, people will only listen for so long before they try and give you a solution, all right? They don't feel comfortable with you feeling upset. They want to give you a solution, in part because it's going to make you feel better, but mostly it's going to make them feel more comfortable. Because let's face it, it's difficult to be around someone who's in emotional distress. That's why I do what I do. I know, and I'm very comfortable being around people that are in emotional distress, and I know what to do and I know what to say, and it doesn't impact on me on a personal level or a draining level at all. In fact, helping people with emotional issues actually energizes me, which is a little bit strange. So there's those two factors going on. So add into the mix, you have chronic illness that's not going to go away. All right? There is no solution to it. So people who live with people who have chronic illness or disabilities or emotional or psychological issues like depression and anxiety or PTSD, it can be very wearing because there is no solution that you can give that person. And depending on how much caregiving you're doing, you can suffer either from empathy burnout, which is what a lot of people in the health profession deal with, like doctors, nurses, caregivers. There's just so much pain and so much distress that you can take before you need to start doing something to shut yourself down, to protect yourself. So you can suffer from empathy burnout, or you can just feel overwhelmed and helpless that there is nothing that you can do to help the person that you love. Now, most people come from this solution-focused process. And if there's any partners watching who happen to be men, guys, you are the worst at doing this, because men love to give you solutions. It's part of what they do so well. When you're in a relationship with a really loving man, he wants to make your life easier and better. He wants to give you solutions to your problems. He wants to fix things for you. So men can often tend to go straight into problem-solving mode. Now, this is where it gets difficult, all right? This is where it gets really challenging. You're the person with chronic illness and you want to talk to your partner and you're saying, God, I'm so sick of feeling this way, and the doctor didn't listen to me, and I don't know what I'm going to do, and I feel so awful, and I'm dragging myself around, and I don't know how long I'm going to be able to go on with this, and you're never helping me, and nobody seems to understand. So that person has no solution to give you. They're feeling either frustrated or completely overwhelmed. And so in order to make themselves feel better, they want to shut you down or turn themselves off so they're not getting distressed. Then we end up in this situation where you're trying to talk to somebody about how you feel. You see them shutting down or dismissing you. You feel they don't care. You feel there's no point in talking about it. You go back into your shell and you feel unsupported and misunderstood and unloved, and all of those things that can happen with the normal isolation of chronic illness. So it ends up in this really difficult place, because when you're suffering and people don't understand, or people don't seem to want to help you, or people don't want to seem to make allowances for you, you can really feel that nobody gives a damn about what's going on for you. And so you just try and push through, and you turn back into yourself, and you start shutting down, which means that you're depriving yourself of the help and the support and the love that you need. So here's where we get into solutions. Let me just put my notes down. Let me have a quick drink because this talking bit is very drying on the throat, especially on a Sunday morning. All right. So here's where you can start to make the changes. And if you're the person with the chronic illness, this is what you need to do. I want you to start looking at the language that you're using and the way that you're saying it to talk to people about your chronic illness. So the first issue of communication is, have I made the issue and the importance of the issue clear? And this usually doesn't happen when you consider that with chronic illness, it can be up to 6 years and 5 or 9 different doctors to actually get a diagnosis. So it means that you've got all of these weird things going on in your body. You're not feeling good. You're not able to focus. You're not feeling like yourself. You know there's something wrong. Doctors are gaslighting you and telling you that you're healthy. So there's all of this stuff going on for a long time until you finally get to diagnosis. And when you get diagnosis, then there's shock, there's grief, there's denial, there's the realization that there's actually very little that can medically be done for you. So it's coming to terms with all of that. So with all of that going on, it's really challenging to sit down and actually talk logically about how important the issue is and why it's really significant. So here's an example that you can use with your family and your friends. So if it's your partner, you can sit down and say, look, honey, I need to talk to you about this chronic illness. Now I know we've talked about it before, and I realise that that's on me, that I haven't really described it in a way that really lets you know how important that it is. So I have this disease, and it's chronic and it's progressive. And because of that, there are certain things that I am no longer able to do the way that I did before. It's not going to go away. And things in my life have changed. I'm not able to have the energy to keep up with the kids. I'm not able to go and have the late nights that we had before. Too much socializing exhausts me. There are things about my diet and my lifestyle that I need to change. And I need to change this because the most important thing to me is my energy and my health, so that I can, as much as possible, be here and enjoy my life with you and with our family and with our friends. This isn't going to go away. It's not probably going to kill me, but it has a profound effect on my quality of life. And that has changed. I'm literally not the same person that I was before. And can you hear, by saying it like that, you're really pointing out that this profound change has come along and it's changed you and it's changed your abilities, and there may be changes you're going to make in your life. And did you also notice that when I was telling you that, I was staying very firmly in my feelings? So I was talking very logically and very clearly about the issues and what it does to me and the effect that it has on me, and acknowledging that I've changed and that things will need to change in order for me to have the best possible life that I can. So what I've done is I've given somebody, this is the issue, it's not going away, I need to do something about it, we need to do something about it. Because the truth is, guys, if you're in a relationship, if you're in a family, if you're in a friendship, this doesn't just affect you, it affects everyone in your life. You have the similar conversation with your friends. So you can say to them, look, I really need to talk to you about this chronic illness that I have, because it's probably my fault that I haven't explained it to you properly, but here's what's happened. I have this chronic ongoing disease. Unfortunately, it's not going to go away. And what this disease does, it affects my energy, it affects my ability to do the things that I did before. It's not my fault. It's not that I don't want to do things with you or be able to go out and enjoy the time we did together or go on the long walks or do all the activities we did before. I love those things. I really miss the fact that I can't do those things. I have this illness. This is what it's called. This is what it does to me. And now I have these limitations on what I can and I can't do. And I would really love it if you could understand that, just to try and understand that when I'm saying no to an activity or when I'm saying no to spending time or when I'm saying no, I need to leave early, I'm not saying no to you. I'm just trying to manage this chronic disease that's come into my life and that has changed so many things. So it's not that I don't love you, it's not that I don't care about you, it's not that I don't want to be with you, it's this disease, and this disease isn't going to go away. All I can tell you is I'm doing the best that I can to try and get as much health going, so I've got as much energy as I can to be able to spend some time with you. So I hope you can see the difference in how I've just talked about that as opposed to how we normally talk about the issues that are going on. So if you're not used to communicating like this, and people aren't because it's not how we're taught to communicate, okay? We're taught to communicate by blaming and shaming. That's what we're taught to do. We're taught to say things like, you never listen to me, you always do that, you make me upset, you make me angry, you do this, you do that. We're also taught to do it for the positive side too, like you make me happy, you make me feel loved, you make all of these different sorts of things happen in me. And that's not how it actually works, so I don't want to go into all of that. But the way that we're taught to communicate with the people closest to us is to blame and attack and shame. And that's not communication. There's only two ways that people are going to respond if they're feeling blamed or shamed. Fight or flight. That's how we're wired. They're either going to get really defensive and argumentative and attack back, or they're going to shut down and close off, and they're not going to listen to you. So there's two ways to go about this. So the first way, as the person with chronic illness, is to make sure that you are articulating this is what the problem is. I mean, you've got to really lay it on the line, guys. This is not some small thing. If you don't take this seriously, nobody is going to take it seriously, because we teach people how to treat us by what we're willing to accept and tolerate. If you let the people in your life treat the chronic illness like it's no big deal and there's something wrong or weak about you that you can't still get up and do all the things you did before, either there's something wrong with the relationship or there's something really wrong with your boundaries and communication. You've got to talk about what this is, what it's done to you, and the impact that it's had on your life, and ask for their understanding. So for the support people, okay, this is what you need to do. Don't try and solve the problem, because you can't. You can't solve the problem. What the person with chronic illness wants is validation. The same as if you've had a really crappy day at work and you come home and the boss has been riding you all day and you want to say to your partner, oh, God, my boss was a complete a-hole today. He's been riding me all day. I'm just so over it. I wish I could just I wish I could just quit and get out of there. I'm just so sick of that job. What you want is you want the person to say, oh, I don't know how you put up with that. That's really wrong. No wonder you're upset. He's got no right to treat you like that. You want validation. You want support. You want the person to say, yeah, I get that. unfair, or that's wrong, or I understand why you're so upset. People shouldn't treat you that way. You want to feel that they're on your side and supporting you. People who don't get validated keep talking about the issue over and over and over again like a broken record. When people get validation, and this is why we need people like me who are counsellors and therapists, people need to feel validated, because people are walking around with stories inside them of things that have happened to them that they don't feel safe telling to anybody else, in case they get laughed at, in case it gets trivialized, or in case it gets used against them. We all want to feel understood and validated and supported. So what you do is do your best to just try and get in their shoes and understand. So if your partner's saying, I'm so sick of this illness, I just feel I'm so exhausted, I feel like, I'm damaging the kids because I'm not there, I feel like a really bad wife, I feel like I'm bad for you, I feel like I'm letting you down with this illness, then you turn around and say, that must be horrible. I can't imagine what you're going through. I love you. I'm always going to be here for you. What can I do? What can I do to help you? What can I do in our day-to-day lives? What can I do to change things around the house? What do you need me to do that is going to help you feel better? So the first step is just listen and understand that what your partner is telling you about their chronic illness, they're not blaming you. They're not wanting you to magically make it go away. They just want you to listen and to offer some comfort and to understand how difficult it is for them and acknowledge what they've lost. And then when that's validated, then when you're hearing from them things like, thank you, or, you're so wonderful, or I really appreciate you, then it's time to move into problem solving. What can we do? What can I do? What needs to change? Because if you're the partner of someone with chronic illness, as I said before, this is not just their issue. If you got chronic illness, if you became suddenly disabled, whether through accident or disease, the simple fact is that as a family unit, as a couple, things would need to change. They do, because life as it was before no longer exists. Things have changed, so things need to be done in a new and different way. It's as simple and factual as that. If your partner has chronic illness, they are no longer the person that they were before, in all of the ways they were before. Can they still be as wonderful and lovable and gorgeous as they were before? Absolutely. Absolutely, they can do that. But the thing is, they've got to put so much effort and make so many changes into managing that, because now when you have chronic illness, your whole life starts to become centered around supporting yourself so that you can maximize the health and mobility and energy and motivation and focus that you can have in that moment. It does get better. It does become just part of how you live. So it's no longer this thing that you really need to focus on. So I just want to go over that again, all right? If you're the person with the chronic illness, the first question I want you to be asking yourself is, have I made it clear how serious this is and how it impacts me, and that things are different, I am different, and things are going to need to change? If you haven't done that, that's the first thing that you need to do. You need to do that in a way that you are not attacking or blaming the other person. You're presenting it as it's a done deal. This is how it is. This is how I feel. This is what it's doing to me. This is what I would like to happen. This is the support that I would have. So you're staying in my feelings. I feel when this happens, this is how I feel about it. There's no finger pointing going on. For your partner, all you need to do is listen. Just listen and try and understand that. Let them talk about what they're going through. They're not blaming you. There's no solution you can give them. When somebody is in a position that you can't fix, the best possible thing you can do for them is just try and get down there, be there with them and reassure them. Because when we're frightened, when we're feeling helpless, when we're in pain, what do we want? We want comfort. We want reassurance. We want to know somebody is there for us. We want somebody just to give us a hug and tell us that it's going to be okay. I'm here with you. I'm not going to leave you or abandon you. Try and give that comfort and reassurance, because that's what people in pain and anxiety need. Now, if you're the partner, you also need a safe space to vent, right? Because living with somebody with chronic illness can be very stressful and feel very demanding, and you're also dealing with your own grief and your own shock and everything that's been going on, because it's really hard seeing this happen to somebody that you love. So it's a really good idea to either be part of a support group, whether it's online or in person, or to go along and see a good therapist and have a few sessions for yourself, because your emotional health is really important too. It's really important that you understand that this is not all on you, right? You can't fix it for the person that you love. You need support too, because it is going to be frustrating. It is really frustrating to not be able to do the things that you used to be able to do before, or to have the help and support from your partner that you were able to count on before, or to have the income coming in when they were able to work and earn more money. So there are going to be stresses, because chronic illness impacts on all areas of your life, emotionally, physically, financially, because doctor and medical expenses can become a huge burden on many couples and families. So it's really important that if you are the partner or the carer of somebody with chronic illness, that you get some help and support too. So that's about all I had to say on that. What I do want to tell you before I take some questions is what I'm doing with many couples now. I'm working with my online programs with couples, so I'm working with the person with the chronic illness and also with their partner. And what we do generally is we split the program, the sessions in their program up. So whether it's 50-50 or whether it's 20-80 or whether it's 40-60, it means that I spend some time working with each person individually, and usually in a joint session with the two of them together. So we make sure that they're both on the same page. We make sure that they're both using the same tools, that they're both using the same communication skills, and they're both understanding exactly what they're responsible for, and more importantly, what they're not responsible for. So it gets people working together. Now, it's really important to know that when I work with couples or family members or siblings or anything like that, that I don't share information. Okay, so if I was working with you and I was also seeing your husband, I would not tell you what your husband had said or vice versa. What you choose to share about your sessions is completely up to you. Now, that can be really helpful because it means that both of you in the relationship have the same skill set and the same framework and the same understanding, and can together you're communicating better, you're supporting each other better. It can create that really nice upward cycling relationship where you have more connection, you have more love, you have more understanding, you have more tools to work with. So guys, I hope this has been useful. Thanks to everybody who came along and watched. And if you've got any questions, hit me with them now, because I'd love to help you out. And while I'm just waiting for some questions, I'll just let you know that how you can work with me is that you can book in a free discovery session with me. Now that's from this Facebook page here. There's a little tab that says book your discovery session. So that's time slots that I've put aside. I'll talk to you on Skype. I'll listen to the issues that you're facing. I'll tell you honestly if I have a solution for you, what you need to do to work with me, and I'll tell you all the costs that are involved and the different payment options that you have. And I can tell you that I charge in Australian dollars, so all of my fees are Australian. Kim just said wise words. Thank you so much, Kerry. Kim, you are very welcome. Rhonda said, I've always been open about what's going on. I think this has been a big help. I'm really glad that helped you. So it looks like there's no questions at the moment. For anybody watching the replay, feel free to post any questions under this and I'll come back and answer them. So I'm going to get on with my Sunday. So thanks for watching. Thanks for listening. I hope this has been really useful and I'll see you next time. Bye for now.